The 3 to 6 month post-stroke recovery period is when 90% of whatever recovery a patient is going to experience occurs. This implies that quickly intervening in every possible way would be the best option for recovery. Results from a 2011 meta-analysis published in the BMJ showed that calcium supplementation, with or without vitamin D, significantly increased the risk of myocardial infarction or stroke in postmenopausal women. The data was taken from the Women's Health Initiative and included a cohort of 36,000 women. The dietary calcium intake of the women averaged around 800 milligrams a day, while those supplementing with calcium obtained an additional 585 milligrams a day. Could their higher risk of cardiovascular disease be caused by a deficient intake of vitamin K2? Vitamin K2 plays a central role in the metabolism of calcium. A study suggests that calcium supplements given as monotherapy at high doses may increase the risk of ischemic stroke, whereas their combination with vitamin D and vitamin K2 seem to offset this hazard. Tests show that the optimum daily dose of vitamin K2 is 300 micrograms per day. Vitamin D supplementation in post-stroke patients is helpful in the prevention of recurrent stroke, and it's suggested to reduce neurological, psychological, and musculoskeletal disorders. It also reduces morbidity, mortality, and improves functional outcome after a stroke. A blood test is the best way to determine your vitamin D levels, and then dose accordingly. A 25-hydroxy vitamin D test is the recommended test. On average, those who had a stroke had depleted levels of vitamin C, while vitamin C levels were normal in healthy individuals. The researchers found depleted levels of vitamin C was linked to longer hospitalizations. People with the highest concentration of vitamin C in their blood had a 42% lower risk of stroke than people with the lowest levels, according to a study in the American Journal of Clinical Nutrition. Ascorbic acid is one of the cheapest and most useless forms of vitamin C, and it can upset stomachs. Better forms are sodium ascorbate or calcium ascorbate, which are pH buffered to prevent stomach upset when given at high therapeutic doses. The best forms for high dosing are liposomal vitamin C for oral consumption, or intravenous vitamin C, if available. As many grams can be taken in a day without the side effects of stomach discomfort. Bioflavonoids also enhance the action of vitamin C. A population-based cohort study suggested that folic acid fortification of food in the United States and Canada improved the mortality rate after a stroke in these countries compared with post-stroke mortality rates in England and Wales, where the routine folic acid fortification was uncommon. A slow-release L-methylfolate dosed at 5 milligrams per day would be recommended. Vitamin B12 can also reduce a stroke patient's risk of having another stroke. It does this by lowering the levels of homocysteine in the blood, an amino acid associated with heart disease and stroke. Methylcobalamin is the most active of the B12 homologs in the body with respect to nucleic acid and protein and lipid metabolism. 5,000 micrograms would be a standard dose of methylcobalamin. Dissolved under the tongue would help ensure better absorption. A B12 blood test is available at your doctor's. However, there's some criticism of this, as certain fortified foods with folate may interfere with the test results and indicate that you have sufficient B12 when you're actually deficient. As B12 is one of the water-soluble B vitamins, there's little need to worry about taking too much, as it gets excreted in the urine, unlike the fat-soluble vitamins A, D, E, and K. A new study shows that a component of fish oil is a powerful therapeutic agent that can protect brain tissue in a model of stroke, even when treatment is delayed by 5 hours. And a recent 2019 study indicated that omega-3s offer neurological benefit after a stroke. Administration of omega-3s after a stroke was shown to reduce stroke-related deficits, likely by protecting the nerve cells in the brain. Doses of omega-3s can range from 3 to 9 grams per day of an EPA-DHA mix. Omega fish oil is a natural blood thinner, so this should be taken into account, especially if the patient is already on blood thinning medicine like aspirin, warfarin, or Coumadin. Coenzyme Q10 works as an antioxidant and may reduce damage following a stroke. CoQ10 may increase the ability of the blood to clot and therefore interfere with some blood thinning medicines, such as warfarin and others. In a study assessing the effects of coenzyme Q10 on endurance, it was noted that a minimal dose of 300 milligrams per day was required for the benefits to be seen. Results indicate that glutathione might inhibit the effects of cerebral infarction and boost anti-apoptotic signaling after ischemic stroke, suggesting that glutathione may be a potent therapeutic antioxidant that can attenuate severe pathologies after ischemic stroke. In other videos, I've talked about some ways to boost glutathione, such as in my PCT video for anabolics. Some of the most effective ways are N-acetylcysteine, dosed at 500 milligrams 3 times per day. The herb milk thistle, ensuring you have adequate selenium levels, which is 200 micrograms per day. Taking reduced glutathione, up to 1000 milligrams per day. TUDCA, TUDCA, is an endogenous bile acid, and it's shown many promising results for the recovery in stroke models. Researchers found that the risk for ischemic stroke, the most common type of stroke in older people, was reduced by 9% for each additional 100 milligrams of magnesium that a person consumed each day. Regularly eating magnesium-rich foods also helped modestly reduce the chances of having any type of stroke. Increasing magnesium intake may be a crucial component of stroke prevention that acts in a dose-dependent manner. And systemically administered magnesium at doses that double physiological serum concentrations significantly reduce infarct volume in animal models of stroke. Magnesium bisglycinate is one of the best forms available. A standing dosage calculation is to take a small amount, then take a bit more each day until diarrhea is noticed. Then reduce the dose just enough to stop the diarrhea. This ensures that you're receiving the optimal dose. As magnesium is required by hundreds of enzymes in the body, it can have profound benefits when taken every day. Very often, surgeons are reluctant or unable to open partially closed carotid arteries using laser surgery. They fear that resulting debris could be pushed into smaller connecting arteries and result in a stroke, and possibly death. In cases of severe arterial narrowing, serrapeptase has been used with excellent, even life-saving results. Many of the patients have shown significant improved blood flow through their previously constricted arteries, as confirmed by ultrasound examination. Unfortunately, orthodox cardiologists do not employ this important method in their practices yet. Studies show that nattokinase dissolves blood clots, which helps maintain good blood vessel structure, improves blood flow, and lowers the risk of heart disease. It can also help lower your blood pressure, reducing strain on the heart that can lead to heart attacks. The ability to break down fibrin makes nattokinase an ideal candidate for research with respect to stroke. Alpha-lipoic acid and L-carnitine. This combination has been studied for its life extension potential. Alpha-lipoic acid promotes neurological recovery after ischemic stroke by activating the NRF2 HO1 pathway to attenuate oxidative damage. 600 milligrams twice per day is a standard dose. L-carnitine may benefit brain function. Some animal studies suggest that the acetyl form, acetyl L-carnitine, may help prevent age-related mental decline and improve markers of learning. This can be dosed at 500 milligrams 2 to 3 times per day. Some common herbs that can help with a stroke are cayenne, garlic, hawthorn, valerian, bilberry, ginkgo biloba, vinpocetine, bacopa, beetroot, and resveratrol. New research has found eating chili peppers dramatically cuts the risk of heart attack and stroke. Naturopathic Dr. Michael Murray states that people in regions where cayenne pepper is a regular component of the diet, they have decreased incidence of not only stroke but also heart attack. When students ask Dr. Schultz what are the 10 most important herbs to have in the home, he says the top of the list is cayenne pepper because it will make all the other 9 herbs work better. Dr. Christopher also believed that cayenne and lobelia enhance the action of all other herbal medicine. Dr. Schultz used cayenne and fresh ginkgo biloba for his stroke patients, and the stroke patients show big improvements within 24 hours. Ginkgo biloba is used to prevent and treat stroke. It increases the blood flow to the brain and helps to prevent blood clots. Ginkgo biloba also inhibits free radical formation. Garlic, a wonder plant, has medicinal properties. It contains a molecule called aggione, which prevents blood platelets from accumulating at one place and forming a blood clot, which is known to cause a stroke. For better effects, garlic should be consumed raw. Hawthorn berries have already been referred to as an all-natural heart tonic for hundreds of years, and it's even known as food for the heart. Hawthorn extract reduces infarct volume and improves neurological scores by reducing oxidative stress in rat's brain following middle cerebral arterial occlusion. Related to apples, hawthorn berries can be eaten like a fruit and don't necessarily need to be taken in tablet or tincture form. You can find many tasty recipes for hawthorn syrups and jams, for example. But remember to limit your sugar intake for stroke recovery, though. Sleep problems are common after a stroke. Poor sleep can slow your recovery and lead to depression, memory problems, and nighttime falls. In a test on mice, where they were either given sleeping tablet or no sleeping tablet after a stroke, some interesting results were noted. Over the month after the stroke, they compared the mice's performance on various tests of sensory and motor coordination ability. By several measures, the mice treated with the sleeping tablet returned back to their pre-stroke levels within a few days of treatment. The control mice, who had no sleeping tablet, took the entire month to recover. Unlike humans, mice do eventually recover from stroke when left untreated. You can see my previous video on natural sleeping remedies for more information. Resveratrol, found in red wine in small amounts. It's been investigated for its life extension properties. Resveratrol administration after a stroke is beneficial to reduce infarct volume, and it's beneficial in the recovery of neurological function in the delayed phase after a stroke. Doses can range from 500 milligrams to 1000 milligrams per day of trans resveratrol. An 8-week study showed that a diet enriched with fresh bilberries increased insulin secretion in adults with metabolic syndrome, a cluster of conditions that increases your risk of type 2 diabetes, stroke, and heart disease. This may be partly because they're rich in vitamin K, a vitamin that helps prevent the formation of blood clots, reducing your risk of heart attack and stroke. In an 8-week study, 35 people who took a mixture of various berries, including bilberry daily, experienced improved platelet function, blood pressure, good cholesterol levels, which are all markers linked to a healthy heart. Vinpocetine is a common herb used to increase blood flow in the brain, and it can help with memory and focus. Vinpocetine is also used for preventing and reducing the chances of disability and death from ischemic stroke. This is the type of stroke that occurs when a blood clot stops blood forming in the brain, causing brain cells, neurons, to die because they're not receiving oxygen. It plays an integral role in the prevention and attenuation of post-stroke epilepsy, depression, and cognitive deficit, either through direct cAMP or cGMP dependent pathway, or indirectly through anti-inflammatory and antioxidant effects. Beetroot juice is high in nitrates, a chemical when ingested is found to increase blood flow in the brain. There have been several very high-profile studies showing that drinking beetroot juice can lower blood pressure, but they wanted to show that drinking beetroot juice also increases perfusion or blood flow to the brain. There are areas in the brain that become poorly perfused as you age, and that is believed to be associated with dementia and poor cognition. High concentrations of nitrates are found in beetroot, as well as celery, cabbage, and other leafy green vegetables. When you eat high nitrate foods, good bacteria in the mouth turn nitrate into nitrite. Researchers have found that nitrites can then help open up the blood vessels in the body, increasing blood flow and oxygen, specifically to places that are lacking oxygen. Biloba manieri has been used in Ayurvedic medicine for centuries for a variety of purposes, including improving memory, reducing anxiety, and treating epilepsy. In fact, research has shown that it may boost brain function and alleviate anxiety and stress, among other benefits. Observations suggest the neuroprotective and antioxidant activity of Biloba manieri on ischemia-induced brain injury. Some beneficial foods for stroke recovery are flaxseed, salmon, blueberries, pomegranates, tomatoes, nuts and seeds, avocados, beans, and red wine. Not only is the overconsumption of sugar linked to most diseases, sugar reduces brain-derived nootropic factor, and it limits your brain's ability to grow new brain cells, which is the opposite of your stroke recovery goals. See my other video on nootropics, as there is also a discussion about racetams and Noopept being effective in stroke recovery. And again, this is not medical advice. Discuss any supplementation with your doctor before starting.